Few patient journeys are as dark, frustrating, and painful at the start, and yet remarkably happy and revitalizing at the end as the one that I'm about to share with you. Jerry had lost all his teeth many years ago and was using a full denture for some time. His denture, however, simply did not give him the function and the aesthetics that he wanted, and that is why he first became interested in dental implants. In order to lower the cost, he decided to go abroad for his treatments. The dentist that he saw placed 6 dental implants along with bone grafting all at the same time, and then delivered a full arch restoration immediately on the same day. Based on the rapid pace of the entire treatment, we're assuming that the implants were placed without a surgical guide or a sophisticated workup. Patient was also told that the teeth placed on the implants were the final restorations, and he was okay to return to US. About 6 weeks later, Jerry began to experience pain, swelling, and also noticed that the entire restoration is becoming gradually loose. And that is when we first saw him for an evaluation. We noted that the entire restoration was mobile and the implants were quite loose. The gum tissues were infected and very tender all around, and there was bleeding around some of the implants. The Panorex and the 3D cone beam CT scan showed 6 dental implants with extensive bone loss around them. It also showed areas of bone graft materials that were surprisingly placed in the soft tissue and not on the jawbone as expected. With the severely compromised health of the implants, the extensive bone loss, and the infection, the prosthesis and all the implants had to be immediately removed. The extensive amount of inflammatory tissues were removed and the sites were cleaned. Also, the bone graft materials that were improperly placed in the soft tissue were localized and removed at the same time. He was then given a conventional denture as an interim prosthesis and allowed to heal. A closer inspection of the implants and the prosthesis revealed an inconsistent type and size of implants and a gross amount of cement material beyond the margins of a very poorly designed restoration. An overall treatment that was biologically incompatible, anatomically inappropriate, and functionally disastrous, with a complex of materials that were assembled with simply no rationale. 2 months later, the infection had resolved and the tissues were noted to have healed quite well. But as noted in the 3D cone beam CT scan, he had severe deficiency of both bone height and width, which was inadequate for implant replacement. There was simply no bone for new implants. To restore the upper jawbone, sinus lift and onlay bone graft techniques were used on both sides to effectively rebuild the vertical and the horizontal bone deficiencies, and then allowed about 6 months to mature. For replacement of his teeth, a fully fixed implant-supported restoration on 7 dental implants was planned. For total accuracy and precision, a complete digital workflow for planning and implementation was followed. First, a cone beam CT scan was done using his denture as a marker. Next, the implants were virtually placed and oriented within the augmented bone while keeping them aligned with the planned restoration. A surgical guide was printed to translate the information and the data from the software to the actual surgical procedure for the placement of the implants. 7 dental implants were placed as planned. Although the implants were quite stable, it was decided not to load them immediately and place the transitional restoration in a delayed fashion in order to optimize the implant integration and avoid any further complications. After 4 months of healing, a full arch transitional restoration supported by the implants was designed and delivered. But we had one more important factor to consider before the restoration: soft tissue. Through the initial teeth loss, severe infections, and then the reconstructive surgeries, the soft tissue quantity and quality had continually diminished, with thinner consistency and also no zone of attached or keratinized gingiva around the implants. So, in preparation for the transitional restoration, a gingival revision and grafting was done to not only make it thicker, but also to recreate the adequate zone of attached gingiva, which is crucial and critical in the long-term stability of bone and the implants. The transitional restoration was then delivered, giving him an opportunity to get comfortable with his new bite and smile. 3 months later, once the soft tissue had matured completely, the final full ceramic restoration was delivered, supported by the 7 well-integrated and healed dental implants. Jerry was now able to smile again and eat his favorite foods, something that he hadn't done for many years. This was truly a transformational moment in his life, as he tells his own story.
Yeah,
Are you happy?
very happy.
Oh my God. This is the moment we've been waiting for.
Almost 2 years. Yeah, 3
Over
years.
2 years. Wow, look at that.
It feels like day and night from the, well, I'm comparing the position and
Ah, give me some big smile there. Let's see.
yeah.
Ah,
I got my smile and health both back
yeah.
in the old body.
Yeah.
This is a gift from God to you, you know. Cannot compare it to anything else. This is one of the best things that happened to me, you know, with regards to dental work.
Thank you.
I was hoping it turned out to be really good,
Mm-hmm.
and it did.
Yeah.
Because, well, well, before I came to you, I didn't know you, of course, you know, but when I came back from my trip overseas to the Philippines, I had my dental work done over there. Not that that was my preference, but then because of the economics part of it, I wanted to save money, you know, because the dental work is so much expensive. So I did that. Went to this dentist that claimed to have specialty in dental implant, and I trusted her, and so I subjected myself to the procedure, and the time that it took was like 2 weeks, because I only had 4 weeks altogether spent, you know, over there. So in that span of 2 weeks, she did everything done quickly, from surgery to the prosthetic. Everything was on the rush, and she didn't have the technology that now that I have been to your clinic, that she should have had. She had the CBCT X-ray that she didn't own. There was a lab downstairs that she sent me to get a scan of it, and then she looked at it. But other than that, it's just the regular dental, you know, equipments, but nothing like what you got. The apparatus that you showed to me, the 3D and all that, and other things. And that is why the work that she did was, my wife always calls it a botch job, and it was a botch job. Not only that, I have infection that she didn't know or tell me because she didn't have the equipment to diagnose it, and the expertise, because you have to be an oral surgeon to do this kind of work. You can't just be a graduate person from dental school and then a few seminars here and there, which I believe she did, because she had some certificates on the wall that she took seminars overseas from Asia to here in the US. And I guess in her mind that made her qualified, and now I know she's not. And many doctors out there are in the same boat, not just overseas, but here as well. Because I've seen so many dentists that I compare you, Dr. Kazemi, to see who's the best. And you are the best. Not just the qualifications, but you went to one of the hospitals in the metropolitan area. I can't remember if it was a
Washington Hospital
Center. You went to the surgery training and all that.
Yes.
I think you were also a team or a head of that.
Yes.
And that speaks volume. Okay? And then the other patients that you have that I look at the website before I made the decision to see
Yes.
you, they are all, I mean, what can I say? These are actual people who went through the process. Okay? And they all said positive things and experienced. Now I know I can share.
How do you love your new teeth after all the...
It feels like it's not an artificial, or it's like my same natural teeth. The feel, well, of course, the look, this is next to perfect because my natural teeth is not as good as this.
Yes.
Even many people there, you know, but I'm so happy, the tone, the shade, all that. At my age, I'm a senior citizen. Now, in my case, everything is perfect now. It's now up to me to maintain my hygiene, personal hygiene. Going to the hygienist to get help for the cleaning, because the brushing and the hygiene that we do at home, even with the dental fix, not enough. You have to follow up, like what we talked about. I have to see you.
Thank you. Yes.
It's like a car, you have to maintain it. Even with the natural teeth, you need to go see the dentist. So I can go to...
What is the first thing you're looking forward to do with your new teeth?
Kiss my wife. Well, thank God, I will pray. And again, of course, I will be praying, but thank God that you helped me.
Thank you.
And I will never forget that. You're the best. And whoever I run into and need some dental work, first thing I will tell them is, don't be a fool like me. Try to save a penny and be a pound full. You know, at the end of the day, say,
Yes.
put your health first and find the best doctor, surgeon, like Dr. Kazemi, and let him do the magic. That's what I call it. You're sent from heaven to me.
Thank you very much.
You're doing
I'm
the
grateful.
work of God. I already talked to you about that.
We have. Thank you.
And then you're sharing it to the people, the dentist, your expertise, and that's what it's all about. Right? And your crew, what can I say to the crew? Your team. The front desk, from the front desk, everything is perfect. I have all positive
Wonderful.
experience from day one. Just go to the best right away. Don't worry about the money.
All right. I'll be on that.
Right?
Absolutely.
Okay.
Thank you.
Thank you so much.